The debate over whether or not people should wear masks in public continues as we wait for the White House to make an official recommendation.
Yeah, since the start of the pandemic, World Health officials have recommended against wearing masks. Not everyone should be wearing them, but as our Stephanie Valderrama explains, experts are now reviewing those original guidelines.
A bandana or a scarf are something most people already have lying around the house. Now, some health experts suggest wearing it out in public as a makeshift mask to help prevent the spread of coronavirus. But others fear it could cause a false sense of protection.
Oh, I'm wearing a mask. I'm protected and I'm protecting others.
Requiring everyone to wear something to cover their mouth and nose while out in public has top health officials at odds.
But don't get a false sense of security that that mask is protecting you exclusively from getting infected, because there are other ways that you can get infected.
The protection is definitely higher than if you don't.
According to the CDC, as many as 25% of people are asymptomatic but can still spread the virus. That prompted the mayors of 2 major U.S. cities to recommend anyone going out in public to cover their mouth and nose. Now, according to the White House Coronavirus Task Force, the CDC is considering making the recommendation a guideline for everyone. But that doesn't mean people shouldn't follow the ones already in place.
And we want to make sure everybody understands it is not a substitute for the presidential guidelines that have already gone out.
Dr. Shady Salib, the chief of staff at Palm Beach Gardens Medical Center, says even a makeshift mask would provide some level of protection.
If you and me go somewhere and I'm wearing a scarf and you're not, I believe I'm more protected than someone who's not.
But covering your nose and mouth might not be enough.
There are some reports now that you can get infected from your eye. So definitely wearing something and protecting yourself is better than nothing at all.
Again, health officials fear that wearing a mask will give people the sense that they can't get sick, which is not the case. It's still not a CDC guideline, so individuals can decide if they want to wear a mask in public. But the best prevention practice is to stay home, wash your hands, and practice social distancing. Stephanie Valderrama, CBS 12 News.